Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about thiocolchicoside. What is thiocolchicoside? Thiocolchicoside is a centrally acting muscle relaxant used to relieve painful muscle spasm. It is semi-synthetic derivative of colchicosides, a natural compound obtained from the seeds of the glory lily. Thiocolchicosides helps relax muscles without directly affecting muscle strength, making it useful for treating musculoskeletal conditions. How does thiocolchicosides work? Thiocolchicoside acts on the central nervous system rather than directly on the muscles. It binds to the GABA A and glycine receptors, which are involved in regulating nerve signals that control muscle tone. By modulating these inhibitory pathways, it reduces excessive muscle contractions and relieves muscle stiffness and pain. Common uses: thiocolchicoside is commonly prescribed for acute painful muscle spasm, neck pain and stiffness, low back pain, muscles injuries and sprains, sports-related muscle strains, painful musculoskeletal disorders associated with muscle contracture. It is often used along with pain-relieving medications and physical therapy for better symptom control. Available dosage form: oral tablets or capsules, injectable solutions, topical creams or gels. Onset and duration: onset of action usually within 1 to 2 hours after oral administration. Duration of effect approximately 8 to 12 hours depending on the formulation and individual response. Important safety information: thiocolchicoside is intended for short-term use, typically no longer than 7 days orally or 5 days by intramuscular injection, unless otherwise directed by a healthcare provider. It is not recommended during pregnancy. It may rarely cause drowsiness, although this is less common than with some other muscle relaxants. Because of concern about potential genotoxic effects of one of its metabolites, regulatory authorities in several regions recommended using the lowest effective dose for the shortest possible duration. Common side effects: diarrhea, nausea, stomach discomfort, drowsiness or dizziness, allergic skin reactions such as rash or itching. Uses in pregnancy and lactation: thiocolchicoside is contraindicated during pregnancy and should not be used. Why is it contraindicated? Studies have raised concerns that one of thiocolchicoside's metabolites may cause genotoxicity, which could potentially harm a developing fetus. Because of this potential risk, the medication is not recommended at any stage of pregnancy, even if the potential benefits appears to outweigh the risk. Women of childbearing potential who are prescribed thiocolchicoside should use effective contraception during treatment. Recommendation: pregnancy category not assigned under current FDA labeling. Used during pregnancy contraindicated. If pregnancy occurs while taking thiocolchicoside, the patient should stop the medication and consult their healthcare provider promptly. Thiocolchicoside is contraindicated during breastfeeding. Why should it be avoided? It is not known with certainty whether thiocolchicoside passes into human breast milk due to the potential for serious adverse effects in a breastfed infant, including possible toxicity and the theoretical genotoxic risk. Breastfeeding mothers should not use thiocolchicosides. Recommendation: avoid thiocolchicoside while breastfeeding. If treatment with a muscle relaxant is necessary, the healthcare provider should consider a safer alternative or advise temporarily discontinuing breastfeeding depending on the clinical situation. Thiocolchicoside overdose: an overdose of thiocolchicoside can affect the central nervous system and the gastrointestinal system. Although severe overdose is uncommon, it requires prompt medical evaluation, especially if a large amount has been taken or if symptoms develop. Symptoms of overdose: drowsiness or excessive sleepiness, dizziness, nausea and vomiting, diarrhea, abdominal pain, agitation or confusion, muscle weakness, seizures, rarely decreased level of consciousness. What should you do if an overdose occurs? Seek immediate medical attention or go to the nearest emergency department. Contact your local poison center. Do not induce vomiting unless instructed by a healthcare professional. If the person becomes unconscious, has difficulty breathing, or develops seizures, call emergency service immediately. Take the medication container or package with you to help healthcare providers identify the drug and strength. Hospital treatment. There is no specific antidote for Thiocolchicosides overdose. Treatment is supportive and may include airway and breathing support if needed, intravenous fluids to maintain hydration, medication to control seizures if they occur, treatment of nausea, vomiting or diarrhea. Activated charcoal may be considered if the overdose is recent and recommended by a healthcare professional. Prognosis. Most patients recover completely with appropriate supportive care. However, large overdose, particularly those associated with seizures or significant CNS effect, can be serious and require close medical observation. Key points. There is no specific antidote for Thiocolchicosides overdose. Seizures are one of the most important serious complications of overdose. Early medical evaluation and supportive treatment are essential for the best outcome.